Hello, and welcome to the DCU Preparation for Practice video series. This video is intended to be a guide to support students in the transition from university theory to clinical placement. This video is not intended as a replacement for information and recommendations from Dublin City University or your partner hospitals. In this video, we will highlight the topics of self-care, problem solving on placement, what to expect from your placement, presenting yourself in the clinical setting, how to access clinical assessment documentation, and finally, some general advice for placement. The clinical setting is a stressful environment, no matter what area you are working in. The most important thing to remember is, if you are feeling overwhelmed at any point during your placement, let someone know. Your clinical placement coordinators are there to support you, as well as your practice module coordinators in DCU. Furthermore, DCU's Student Support and Development Service has many resources which are available to further support students. Links to these resources can be found at the end of the video.
An important aspect of self-care while on placement is diet and exercise. It's important to try and bring a packed lunch with you on placement. Buying your lunch in the hospital is expensive and very often can be limited in healthy options to choose from. In terms of your health, there are also useful resources on campus, such as the Campus Health Centre, Campus Pharmacy, and the DCU Gym. A challenge you will be faced with on placement is finding a healthy balance between social life and academics. Individual judgment will need to be used to find this balance, but some advice may be to try to become familiar with your modules and due dates for all the assignments. Try and start the assignments early, as leaving them to the last minute will only add pressure. The following should be an unnecessary piece of advice, but do not come into placement hungover. This will give you an extremely negative reputation among hospital staff. Furthermore, it'll be reported to the clinical placement coordinators and your module coordinator in DCU. And smokers, please be aware that the smell lingers. When you return to the clinical area and are around patient and colleagues, this can make the patients feel worse, especially if they feel nauseous already. You know, for your own health, it would be better to stop, and there are supports in place to help with this. Finally, make sure you claim back travel allowance. Even a small amount of compensation can make a difference as a student. Your SALO will be able to advise you on how to do this.
If you encounter issues on placement, it's important to know who to contact. Your clinical placement coordinators are an excellent resource and will be able to assist you in solving a problem, or will be able to advise you on who to approach with the problem. In terms of academic issues on placement, you should familiarise yourself with the practice module coordinators' email addresses, as this will be the main line of communication with DCU while on placement.
While on placement, you will encounter situations which may be distressing to you. Some possibly distressing situations you may encounter can include mental health disorders, addiction issues, critically and acutely unwell patients, patients at the end of life, or social issues of neglect or abuse. Presentation plays an important role in your performance on placement. Your uniform should comply with the policies of your partner hospitals, and your appearance needs to be presentable. You will also need to show an interest in learning while on placement. The process of finding your clinical placements and accessing clinical assessment documentation can be seen here.
What follows here are some useful resources available to you. These will be invaluable to you to support you throughout your placements.
We'd like to thank you for watching this video, and we hope that you feel more prepared for your transition to clinical practice.